At the time of this recording, I am 2 weeks away from being part of a panel at the Mid-Atlantic Shoulder and Elbow Society Conference. Now, this panel consists of me as the physical therapy representative and several other orthopedic surgeons that are shoulder specialists. Now, my panel, the topic is shoulder instability, and I am there to discuss what we do to manage shoulder instability non-surgically and also participate with the other physicians to discuss how we differentiate when somebody is needing surgery versus when something can be managed non-operatively with rehab in my world. Now, shoulder instability is challenging because with great mobility, right, comes great responsibility, right? More mobility, the more we have to be able to control. And the shoulder is the most unstable joint we have in our body, which inherently allows for all of this motion that we're able to create to do amazing things such as throw a ball, for instance. Now, when we have shoulder instability, what we tend to suffer is a lack of control or stability from what we call the passive restraints in our body. That is the tendons, the ligaments, the things that are not underneath our conscious control. So it puts even more demand on the neuromuscular system to be able to control the shoulder and what we're doing. This is where exercise and rehab and training come into play because we need to really be on point with our movement skills, making sure that our rib cage is in that proper position that I've talked about in other videos, making sure that our shoulder blade can move as effectively as it needs to, and then making sure our rotator cuff is just incredibly strong and operating efficiently throughout an entire process of what might be necessary for whatever our functional activities are. Now, if we're trying to differentiate, do we need surgery versus do we need rehab? Well, that's where seeing a physical therapist can come into play. Oftentimes it's helpful. We can typically get you in a lot quicker than maybe seeing your orthopedic doctor. And we are also trained to be able to recognize when is this something that we can be able to manage and help you with versus when do we need an extra set of eyes on here? Maybe when is there something that's just torn to a point that, hey, there's nothing we can do really about this to rehab this away. Maybe we need a surgical consult. And the best surgery is the one that is avoided. So it's always best to see if there's anything you can do to manage something surgically first before just immediately going to that step, because that'd be just a very aggressive maneuver. Because no matter what anybody tells you after shoulder surgery, your shoulder is different. It's not the same. It's not the tissue you were born with. There's work that was done to it. And the more repairs, if you will, the more stuff that is stitched down, replaced, maybe moved from one place to another, the more your anatomy changes and the more that function of that shoulder is going to be different. So for those of you out here watching this, if you're the parent of, let's say, a high school athlete, specifically I'm thinking baseball, I strongly recommend if your child's having issues or you yourself are having shoulder issues, sooner rather than later, get it checked out by a PT so that this way we can recognize exactly what's going on and if more is needed and potentially maybe catch something before that extra step of maybe needing to bring a shoulder surgeon into the equation is really, really needed. So for those of you out there looking for a solution to those shoulder problems you may have, we're here. Contact us. You know where to find us.